Hypersensitivity reaction. So in this video I'm going to talk about four different types of immune responses that cause four different types of hypersensitivity reactions. So the one that we sort of think about as the classic allergy is called the type 1 hypersensitivity reaction. And this is where we have the immune globulin IgE that is attaching to a recognized antigen. Okay, so sort of binding with this antigen, and then as antigen antibody complexes, they move over, to a mast cell, and mast cells, remember, are these granulated cells that are filled with, among other things, lots and lots of histamine. So when this antigen antibody complex binds with this mast cell, this causes the mast cell to, the sort of vesicles of the mast cell release their load and release histamine. And what does histamine do? Well, histamine causes vasodilation, and it causes capillary leak. So you get opening up of these epithelial walls, and it causes proteins and extra fluid to leak out into the tissue. And it causes the classic symptoms of your urticaria and hives. And then if it's bad enough, it can cause swelling in the larynx, and if it's really bad, it can cause such severe vasodilation and capillary leak throughout the body that it can cause anaphylactic shock. And anaphylactic shock is because if we have massive vasodilation and capillary leak happening instantaneously throughout the body, we have a dramatic drop in blood pressure, and that is what causes the shock. And we're also getting pulmonary edema and laryngeal edema, so we may have difficulty breathing as well. So it's a life-threatening condition because of the drop in blood pressure and because of the loss of airway or potential loss of airway. Okay, so that is the type 1 hypersensitivity reaction or allergy. Now, we want to talk about type 2 next. Now, type 2 is also called a tissue-specific reaction. So a tissue-specific reaction is when we have a tissue, like I'm going to give an example of the epithelial cells of the small bowel. So we have some cuboidal epithelial cells in the small bowel. Well, the small bowel has these villi, and the example I'm going to give you here is celiac disease, which is an example of a type 2 hypersensitivity reaction. And what happens is we get gluten, which is a protein from wheat that binds with the cell walls of the small bowel, these epithelial cells, and then what happens is we have immunoglobulins that bind with the gluten on the cell wall. And then we get a process of inflammation. So the antigens sort of deposit themselves in the tissue. That's number one. And then number two, the antibody binds to that tissue. Then number three, we start to get complement reactions. So we have complement and other proteins. And so number three is we have the process of inflammation And what does complement do? Well, among other things, it starts calling neutrophils to the area. So we get neutrophils coming to the area, and they're going to start phagocytizing um, the this sort of whole portion of the cells, and the cells are going to die. Neutrophil phagocytosis. And it destroys, and it causes cell death. So the last phase is cell death. So this is called a tissue-specific or type 2 hypersensitivity response that involves the antigens, in this case gluten, binding to the cell wall, the number 2, the immune globulin, connecting to that the gluten that's bound to the cell wall, complement being activated, causing inflammation, neutrophils being called to the area, and neutrophils phagocytizing, whole sections of the cell wall along with the antigen antibody complex and causing cell death. Okay, next I'm going to talk about the type 3 hypersensitivity reaction, and this is an antibody antigen complex reactions. Now, antigen antibody complex reactions are caused by IgM, which, different than IgG and some of the other immunoglobulins. IgG is a very simple immunoglobulin. It's only made up sort of one component. IgM has 5 components, and this type of immunoglobulin is very efficient at causing agglutination. And so what happens is we end up with an antigen, complex antigen, binding with this, and it quickly agglutinates into this huge ball of antigen antibody complexes, and these create these gigantic molecules that are really, really big. And what happens is these molecules, these giant agglutinated molecules, end up causing all sorts of problems in places throughout the body. In particular, we end up with significant problems in the kidneys. So, and when we talk about the kidneys, we'll talk about this a little bit when we talk about specifically allergic glomerulonephritis. So if you picture a giant molecule like this that is sticky and has lots of binding receptors on it, and it is traveling through the very narrow microvasculature of the glomerulus, what happens is this tangled mass and a whole bunch of these tangled masses get stuck in the glomerulus. So we have this huge antibody, this huge blob of antibody antigen complex that gets stuck in the microvasculature of the glomerulus, and that causes a glomerulonephritis. Okay, so we can have an allergic glomerulonephritis, or we can have a glomerulonephritis that's actually caused by infection, like a streptococcus infection. But the allergic glomerulonephritis would be a type 3 reaction. And we also can have, these antigen antibody complexes can also bind up microvasculature in other places of the body as well, and cause microangiopathy throughout the body. Okay, so moving on to what's called the type 4 hypersensitivity reaction. A type 4 hypersensitivity reaction is also called a delayed hypersensitivity reaction. Okay, so poison ivy is kind of the prototype of this. So remember, leaves of 3, let them be. Poison ivy. So what happens with poison ivy is poison ivy has a chemical on it that causes a delayed hypersensitivity reaction in lots of people. And the chemical, I believe, is called a cortical molecule. And so these cortical molecules actually, when you touch them with your skin, so you just touch it with your finger, and what happens is the cortical molecules actually bind with proteins in the skin, and then these proteins within the skin, along with that cortical molecule being bound to it, actually activate T cells, and the T cells cause a localized inflammatory reaction within the tissues, and it causes a dermatitis. And this, the T cell response takes about, well, 3 to 4 days to occur, and it causes the typical rash. So we also can have delayed hypersensitivity reactions to drugs. My wife developed a delayed hypersensitivity reaction to fragmin, which is a low molecular weight heparin, and her rash looked very much like a poison ivy rash with little fluid-filled papules. Another similar type of reaction that can occur is what's called a photoallergic hypersensitivity, and this is something that I actually get when I take an NSAID, I get a delayed hypersensitivity reaction only if I am exposed to direct sunlight. So what happens is there's NSAID molecules floating around my bloodstream, and everything is fine until I'm exposed to the sun, and then something about the exposure to UV light causes the proteins in my skin to bind with these with the NSAID molecules, and it causes what looks like poison ivy on my skin after 3 or 4 days. And interestingly enough, those of you who may have had this problem, you will note that sunscreen does not help. The only thing that helps is either the barrier sunscreens like zinc oxide will help, or clothing, but regular sort of UV protection, the chemical sunscreens, will not work. So if you ever notice yourself getting rashes because you're taking medications, you may have a photoallergic hypersensitivity, which is a type of delayed hypersensitivity reaction. Okay, so one pathophysiology that I wanted to discuss that is essentially a hypersensitivity reaction in our body is called systemic lupus erythematosus. This is a very complex disease that is not well understood, but the current theory is that systemic lupus erythematosus is related to both inheritance, because we know that it clusters in families, so inherited genetics that predisposes people to disease, and then acquired environmental factors and infectious factors. So there are viruses that are implicated, Epstein-Barr virus and varicella, I believe. And what occurs because of these factors is that, first of all, we have a heightened activity of B cells and plasma cells. So we sort of have this immunoglobulinemia because of a very active B cell line. So we have an elevated production of immunoglobulins floating around the bloodstream. So that's one part of it. Then another part is we have a loss of self-tolerance and increased activity of helper T cells. So these are increased, and we have decreased activity of suppressor T cells or Tregs. Now, all of this combines. Oh, and then one other. So this is the second aspect, and then the third aspect is that there is abnormal cell breakdown or apoptosis. So the breakdown of cells is it's not that there is necessarily more breakdown of cells, but when they do break down, all of their parts aren't broken down completely. They're not lysed completely, so we end up losing a lot of. We end up having a lot of phospholipids and a lot of nucleic acids entering the bloodstream. Okay, so we end up with these little particles of DNA or nucleic acids and phospholipids from the cell membrane entering the bloodstream. And this combines to create a situation in the body where we are developing large amounts of anti-nuclear antibodies and anti-phospholipid antibodies. And this is a bad situation because now we have a situation where the Tregs and T helper cells are not helping the body to be able to differentiate between self and non-self, and then a situation where we have lots and lots of anti-nuclear antibodies and anti-phospholipid antibodies. And obviously, if you have anti-nuclear antibodies, you have a chance of attacking the phospholipids in the cell membrane on healthy cells and the nucleic acids inside healthy cells. So you're going to end up with significant inflammation in many systems throughout the body, because every single cell in the body has phospholipids and DNA. So this is why it is such a multicellular disease. So we can have problems in microvasculature where we have immunoglobulins that are attacking either free phospholipids or free nucleic acids, or the nucleic acids on red blood cells, or it can directly attack the kidneys. It can directly attack the joints. So the common manifestations of systemic lupus is rash, and that's due to inflammation in the skin, obviously, arthritis, lung lesions, Raynaud's disease. Now, Raynaud's disease is a microvascular disease where you end up with these immune antibody complexes that are sort of gumming up the works inside the microvasculature of your fingers and toes, and that causes decreased perfusion and ischemia and pain in your fingers and toes. Okay, and nephritis. Now, of course, the rash with systemic lupus is the sort of typical butterfly rash pattern, which can occur on the face. And for those of you who haven't seen it before, it kind of looks like, it kind of has this shape on the cheeks like this, and then it kind of covers the nose, and it forms sort of this butterfly pattern. And that is the typical rash that is very common with systemic lupus, although not all people with lupus will develop that rash. Okay, that brings us to a conclusion of the brief introduction to the immune system. After completing this session and doing your reading, please let me know if you have any questions.